The heart has three surfaces: sternocostal surface, formed by right atrium, right ventricle, and apical part of the left ventricle; inferior or diaphragmatic surface, formed by the two ventricles, plus the lower part of the right atrium, where inferior vena cava opens; and a posterior or base of the heart, formed by the left atrium. It has four borders: the right border formed by the right atrium, left border formed by the left ventricle, inferior border formed by the right ventricle plus apical part of left ventricle, and superior border formed by the roots of the great vessels. The atrium is divided into two compartments by the sulcus terminalis, corresponding to crista terminalis on the inside. Anterior to that, the wall is roughened by musculi actinity, whereas the posterior part is largely smooth, and it receives superior vena cava, inferior vena cava, and the coronary sinus. Superior vena cava is valveless, doesn't have valve. Inferior vena cava has rudimentary non-functional valve, so as the coronary sinus has rudimentary non-functional valve. The right atrium communicates with the right ventricle. Sorry? I'm not using anything, no.
Can I take it?
Okay. The right atrium communicates with the right ventricle through right atrioventricular orifice, guarded by tricuspid valve. The cusps of the valve are arranged so that two anterior and one posterior, or simply anterior, septal, and posterior. The right ventricle is thrown into prominent irregular ridges, the trabeculae carnea, and these form three prominent papillary muscles and a moderator band containing the right branch of the AV bundle. The apices, or apex of each papillary muscle is attached to these three cusps by chordae tendineae. Also, blood leaves the right ventricle through the pulmonary trunk, guarded by the pulmonary semilunar cusps, three cusps. Two anterior, one posterior, or simply anterior, right, and left. The left atrium, similar structure to right atrium, and the smooth part receives the four pulmonary veins, two from each lung, bringing highly oxygenated blood. The right ventricle, the left atrium communicates with the left ventricle through the left atrioventricular orifice, guarded by the mitral valve or bicuspid valve, which has two cusps, one anterior, large anterior, and one smaller posterior. The arrangement of papillary muscles and everything is similar, although there are two papillary muscles, not three, and no moderator band. Position of the valves. The pulmonary valve is located at the medial end of the third costal cartilage. The aortic valve is located behind the left half of the sternum, opposite the third intercostal space. And the mitral valve is located on the left side of the sternum, opposite the fourth costal cartilage. The tricuspid valve, on the other hand, is located on the right side of the sternum, opposite the fourth intercostal space. Yes? Opposite the fourth intercostal space. Any questions? يعطيكم العافية. توفيق يا شباب.